We'll start sharing. We're going to talk a lot about menopausal skin, which has been something that myself and a core group of the clients have been really concerned about. Necks, décolletés. I mean, not only the face, but they want to know what they can do for all this. So we're just going to give a little piece of what we've been doing to advance on this. There's modalities and ultrasonics and neck tightening devices that can be used along with this. But we're going to go into a little bit of, before we get to the demo, which is always the most exciting part of it, we're going to go through a little bit of theory on it. So let's get started on that so then we can spend a lot more time doing the demonstration so everybody can see what's going on. There we go. Okay, so basically what we see when we deal with skin that is kind of breaking down or that is lacking in hormones, we definitely see that there's a significant studies that show the clear relationship between estrogen and aged women appearing due to overall skin health. So it's a fine balance between estrogen, progesterone, and other hormones that really keep our skin healthy. So you guys will see this when you start seeing clients come in and their skin is dry. There's no moisturizer that will cause the skin to hydrate. So they're complaining about dryness. They're complaining about broken capillaries. You know, estrogen is very important because it ensures the function of our reproductive organs, but also preserves bone mass. And bone mass is very important, especially when you look at the structure of the face. It also contributes to elastin and hydration of the skin. Again, talking about no moisturizer will moisturize my skin. It's also the key player that really helps maintain a youthful, healthy skin. When we think about a healthy skin, I was just listening to a plastic surgeon talk about this. We think about a layer because they do filler and they do Botox to kind of bring us back to that youth, but it's that youthful layer of fat underneath the skin, and it's kind of like the mattress. So I always think of the skin as a mattress, and I always want to keep that mattress kind of full and not sagged. So progesterone, estrogen, and testosterone all together help with that condition of the skin. You know, progesterone actually has effects on sleep and anxiety, so it's more of how we emotionally feel. How much sleep are we getting? Because when we don't get enough sleep, the skin looks very tired, the skin looks dry. Testosterone affects stimulation of sebum. So as our testosterone depletes, so does the sebum. The sebum is naturally what keeps us younger. It's like our skin's own moisturizer. And that's what keeps us with that younger look to the skin. Everybody wants to know, like when they come in, like, how do I get rid of the pores on my nose or in my T-zone? And I say, well, first of all, I evaluate it. Refining them is one to help them look smaller and finer. But if they're producing sebum or they're producing oil, you're going to look younger naturally because that is the body's way of keeping that skin looking younger. If it's not clogging and you're not dehydrated, then it's gonna flow out and be able to be washed off. So I don't necessarily try to stop the production of the sebum or to dry it up. I just try to refine it, keep it from clogging, and keep it from dehydrating so that you don't get blackheads or whiteheads. Testosterone also can trigger acne, dryness, and it is what stimulates hair growth. So when our testosterone fluctuates, or maybe we have too much testosterone, not enough estrogen, you'll see hair growth happening where you don't want hair growth, like chin, lip, anywhere like sporadically on the cheeks. Testosterone is what thickens skin. So it's what gives us a more youthful look. Probably is the reason why men stay looking younger a little bit longer than women, is that testosterone part of it. The role of hormones. I mean, they're very important to fibroblasts, melanocytes, hair follicles, sebum glands, wound healing, and immune response. So immune response to a healing of a wound or a cut. These are very important roles in hormones. When you are deficient in these hormones, this is what you'll start hearing clients complain about, is thin skin, less collagen, dryness, loss of elasticity, drooping skin. Reduces the vascularity in the skin. impaired wound healing. So all of a sudden a cut of an acne lesion will take a little bit longer to heal. Hair loss. You hear a lot of people come in and talk about, well, my ponytail is not as thick as it used to be. Hair loss is when hormones start to deplete. Pigment changes, irregular conditions of the skin, pigmentation, large pores from the loss of the elasticity. So a large pore kind of looking like it's stretched or extended, and that's just from that loss of elasticity in the skin. So 30% of women will lose their collagen in the first 5 years of menopause. After that, 2% thereafter. So, that's pretty significant in the beginning stages of, menopause. Not only are we going through the change, the hot flashes, the, heat, we're also going through the dry skin. We're also going through the skin looking different. The skin looking a lot less firm, tight, starting to sag. Bone density changes. So the muscular structure of the face starts to change. Fat loss starts to happen, and that's really why you'll start to see a lot of the plastic surgeons or just facial surgeons start to be putting fat back into the skin. Fat or injectables. This actually firms and plumps the mattress back up, so it makes it look more youthful. Definitely, this is what causes your lines, your wrinkles, your elasticity or loss of elasticity, and your thin skin. So hormones are very, 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 very important. How do we restore? How do we stimulate the skin at home? Well, there's a lot of home care out there that's really, that is great for loss of hormones in the skin and aging of the skin. So we're going to go through a few products, but really look at these ingredients. You're going to see some of the products that we have that we actually work with and formulate that have like these ingredients that are very important to somebody that's going through the change or hormone changes. So matrixyl peptides. You guys see a lot about peptides out there. Everything for anti-aging's got peptides in it. This encourages the skin to act younger. It facilitates and causes collagen to stimulate. It's great for cell turnover. It's brighter. It's great for a smoother, brighter skin. And the peptides actually cause the kind of with your muscle contracting. So it got the name of alternative to Botox. And the reason why that is because it just relaxes the triggers that tell a muscle to frown. So it's helping with that. So even if somebody's doing Botox or doing any type of injectables, peptides are very important in the skin. You'll start to see a lot with stem cells. We use some apple stem cells. You guys will see stuff with embryonic stem cells. You'll see stuff with bone marrow stem cells. These are antioxidants. They're a powerhouse for rejuvenating the skin. And then, of course, vitamin C. 20%, you want to make sure you have 15 to 20% in any of your products. This prevents and corrects visible signs of aging, lines, wrinkles, laxity, discolorations. It just brightens the skin. When you look at a youthful skin, you see a plumpness to it and a youthfulness to it and a hydration to it. So that's really what we're going after with all these products. And of course, alpha hydroxys. They really help break down that top layer, and they just help drive actives into the deeper layers of the skin, making all of your skincare more effective. So very important for AHAs. Epidermal growth factors, really fun product that we work a lot with. We ultrasound this in. We do a lot with needling. So basically, this is a growth factor that targets the cell that produce collagen and elastin. It encourages the skin to hold the moisture and strengthen the skin's barrier. So you can see why this is a very important product or an ingredient when we're doing anything with needling. We want to really build that skin back up. And hyaluronic acid. Hyaluronic acid is very important for water. You guys see it all over the commercials. We've got stars that are promoting hyaluronic acid. This helps boost the amount of moisture in the skin. Again, everything's about making that skin supple, plump, hydrated, and smooth. You'll see this other product that we have that's called Rapid Renewal. It's alpha lipoic acid. Alpha lipoic acid is a power antioxidant. At a certain point, vitamin C's or other ingredients like vitamin E, it's just not enough. So what this does is it is a powerhouse antioxidant. This tightens, smooths, refines, really works with the elasticity of the skin to really help that structure stay tight. Again, you'll see some apple stem cells, powerhouse for rejuvenation. Retinols, love retinols, and I try to use them whenever we can. And when I put somebody on a rejuvenating program, especially after doing the needling, is I will have them use retinols every night. And what this does is it stimulates the collagen and the production of new blood to the surface. It also causes a exfoliation, but with these new retinols, you don't actually see that skin peeling. It just causes a rejuvenation of the top layer, and it causes a stimulation of growth. So you get new cells, new skin cell, and an exfoliation, but without all the peel of the older versions of retinol. Hyaluronic acid. So we do have a product that's called Rest and Restore. It's 10% hyaluronic acid, which is pretty much an unheard of amount of hyaluronic acid in a product. This is a clinical strength amount of hyaluronic acid. What this does is it increases the overall water content of the epidermis. Again, plumping, hydrating, more youthful, resulting in a softer, firmer looking skin. It also helps with the skin being healthy, so then products penetrate, any of your peptides penetrate, your C's penetrate better into the skin, so it helps your actives. There are a lot of different types of options. I mean, when we're just talking about needling as one of the procedures today, but minimal to invasive procedures that address, your topical layer of skin concerns. So we've done a lot with RF and needling. So this is actually with a radio frequency needling device that goes into the skin, tightens the top layers, and you're causing that wound with the needle. Laser, there's a profractional, there's a fractionated laser, there's an IPL. I mean, these all work great for clarifying the top layer, helping reduce broken capillaries, helping reduce lines, wrinkles, and addressing laxity. You're doing it with a laser versus a needle. The laser does the same thing, shoots tiny beams down into the skin when you're dealing with that fractional laser, and it causes that wound, then the healing occurs. Hormone replacement, actually putting your clients or advising or even working with a doctor that does hormone replacement is very important. Not everyone can do hormone replacement well. You need really a doctor that's focused on hormone replacement. We actually have a gynecologist that we work with that does hormone pellets. Pellets, pills, creams, and injections. I mean, these are important if your client can. And I know there is those women that have had breast cancer and they can't do any of this, and that's a whole nother class. And I know there's a class coming up on oncology, but the pellets, creams, and pills, if they can be used, really change the way one's skin looks. It changes the sleep patterns. It changes their overall energy level. So it's very important to have at least in your referral bank a doctor that can do something with your clients if that's the way they want to go. Injectable and fillers, the same thing. We have injectors that work exactly or with us directly, and the reason why I like that is because everybody's doing injectables out there. Everyone is doing fillers out there. There's a wide range of estheticians, from estheticians to doctors to podiatrists to dental offices that are doing this. I like to keep it in-house or know who I'm referring to, so that my client or patient doesn't get lost in what's out there, because they are putting out equipment, machines, procedures faster than they actually have results for them. So I like to keep them focused on what the ultimate goal is. So injectables actually do the replacement of the volume that really changes the skin. So I like injectables. I like the way they look. Definitely you want to do your needling first and your series of needling first before you suggest injectables to someone, just because you don't want to break any of that injectable down, or you just don't want to be the blame if the injectable just doesn't work real well for them. And then of course plastic surgery. You know, nothing is better than a nice facelift to put everything back after years of laxity in the skin. So it just repairs the laxity and the fat movement in the face. So where your cheeks are kind of at your jaw area, there's really not a whole lot we can do at that point for services if they want it completely gone. And we'll talk a little bit more about that. There's actually some good pieces out there of plastic surgeons that really like that superficial fat to stay there, and really what they go after is the deeper fat, or when they pull it all back up, they've got that natural fat. And there's doctors that prefer fat injections over injectables. So there's a lot out there, and I really encourage you to look it up and get your information, because that's really important to when you start working with a lot of menopausal skin. You know, what works in the treatment room? You guys have seen a lot of this stuff. You have a lot of this stuff. I'm a big cheerleader for combining it all. I love concierge aesthetics. You know, it's really hard to build a menu when you want to use so many things on one person, just depending on, you know, what they have the need for. And I will literally do everything on this page to a client in different areas of their skin, depending on the need of what's there. So chemical peels, I love chemical peels. They help prevent the cell buildup. They reduce the pore size. They soften the texture. They help with precancer cells on the skin. They promote an even tone, and they rejuvenate. I mean, how long have we been doing chemical peels, and how long have they been performing over and over and over again? Do not put those down. Do not, your alpha hydroxys, your beta hydroxys. These are an important part of your back bar. And I suggest that everybody has an arsenal of peels. Ultrasonic, I've been working with ultrasonic for probably over 25 years now. Love it. I like how it cavitates to exfoliate the skin without damaging the skin. So when you have hormonal skin, you have thinning of the skin. You start to see a lot of vascularities of the skin. The last thing you really want to do is put a microderm near that skin that has a lot of broken capillaries. And if it's loose skin, you don't want to suck that up and draw it, because you'll end up with these tiny little hickeys all over the face. So ultrasound is my go-to, because it ablates the dead skin cell, and it helps kind of clear out those pores, those light blackheads and whiteheads. You start to see all that come out. By the same time, it's combating dryness because it's penetrating product into the skin. It's improving elasticity because you get a little bit of heat with it, so you're getting a drying of the skin. And it does a little lymphatic drainage, so you're removing waste, toxins, and fluids that are just kind of stagnant and sitting there like puffy eyes. So you get a nice contour to the face. You get a reduction in wrinkles. It helps with acne, especially if they have active acne that has infection in it. You can actually reduce that with the ultrasound. And again, everything is about promoting collagen. This is your #1 machine for helping with that. So peels, ultrasound, microderm. Microderm I'll use only on an oily skin. And especially if somebody is starting in hormones and aging, and maybe they have acne and they're getting jawline acne, they're getting cystic acne, I will spot treat with microderm on someone like that. My preference is to use a crystal bliss microderm, a diamond tip. You guys have all seen those out there. And I've learned some fancy tricks along the way. If you do have a microderm machine and you just have some suction, a lot of places sell a little tube that plugs into there, and then you have a crystalless head that goes right onto that handpiece, and now you have 2 in 1. So I suggest that you guys look for that and you get a microderm that you can do crystal and crystalless, because crystal free is very important when you're dealing with hormone depleted skin. It improves the elasticity, it helps reduce wrinkles, it helps reduce acne, scarring. If you're dealing with crystal, then you can help reduce acne because of the creme de crystal kind of embedding in that acne lesion and causing it to dry up. Because you're doing all that wounding to the skin, just like we're going to learn with needling, you're wounding the skin, you're microscopically wounding the skin with your microderm, you're promoting collagen. You can actually take off some surface discoloration, and in that promotes a more even tone, softer texture to the skin. Microderm, like I said, I use in areas, upper lip, fine lines, forehead, the number 11 between the eyes. This is it's an important tool. Microneedling. So after we all came back from COVID, microneedling just hit the roof. We do like 3 different types of microneedling in our facilities. Microneedling we really use for lip lines. We use for fine lines around the lips, the chin, acne scarring, fine lines in the cheeks, the forehead. It really helps because you're wounding the skin again, you're promoting the collagen. When your collagen is promoted, it kind of gives a little filler to your own skin, which then reduces wrinkles and improves the elasticity because, again, you've built that mattress back up so everything looks tighter. And then you have a softer texture once you heal and a more even tone. So all resulting in rejuvenation. These are all fabulous, excellent. I mean, you don't need anything fancy. I know there's a lot of other units out there, but if you have these 4 devices, or peels are more than 1 device, but if you have this in your back bar or in your room, this is going to be all you need. So microneedling, you guys have seen this. You've seen this patient client come in. You see the number 11s. I mean, we all know that if we refer them out, they get a little Botox, all of a sudden all that's going to relax and look better, but it's not going to completely go away because these are pretty deep lines, and these are what we've seen a lot of after people came back. They weren't doing much. They were getting out in the sun, and they were damaging the skin. So we had a lot of work to do once we came back. With this patient and client, when you're looking at them, you're seeing several different things. You're seeing the porousness of their skin. You're seeing the pigmentation on their skin. You're seeing the thickness of their skin. And when you look at this is what we mean by thickness. And then you're also seeing that deep embedded lines. So the microneedling actually addresses most of these concerns. You have that breakdown of skin, you have that breakdown of estrogen, of progesterone in the skin, and this microneedling procedure is gonna improve this patient quite a bit once we do the procedure on them. We will not be seeing this patient today or this client today. I go back and forth with patient and client, and I apologize for that because we work with a medical part and an aesthetic part in our practices. So some of us call them patients, some of us call them clients. So I'm going to try to clarify that a little bit. Let's go. Who benefits from microneedling treatments? Who's a good candidate? Fine lines, wrinkles, texture, pores, dull skin, lack of luster to the skin, thickness of the skin. I mean, this right here, client is going to benefit from this treatment. Who is not a candidate? Somebody that has a history of keloid and scarring. Someone who has an immune suppressed or immune compromised system. Vascular disease, scleroderma, pregnancy, nursing mothers, dermatitis, eczema, psoriasis, really has unmanaged herpes simplex, so cold sores. And I'm not saying you can't do it, because you just have to make sure that they're well aware of how to proceed if they are feeling like they're breaking out with a cold sore. Diabetes, and then raised skin lesions. I say raised skin lesions because there are some precancer cells that you have come across on the skin. some basal cell melanomas on the skin, and the last thing you want to be doing is stimulating that with needles. The protocol is generally very, very simple. You cleanse. I like to peel prior. You neutralize, you re-cleanse, and then you needle. I always needle with a little bit of Rest and Restore, which is your hyaluronic acid. It gives me a glide. We'll look at the technique. Some people say drag. I don't like to drag because I don't like to drag everywhere, because when you're dragging, you're tearing the skin. So I like to stamp. I use between 12 and 36 needles, and then just depending on the depth, which we'll go over depths of the skin and the wrinkle, depends on how deep I go on that area. You can actually calibrate the machine that I'm going to be using. Evaluate to make sure that you've had enough stimulation of the skin when you're doing this. And then I like to just apply a little epidermal growth factor on top and send them home. I like when the skin weeps a little bit. You guys all have heard about like where they use the blood cells and they spin it backwards, they extract the blood, spin it backwards, and then put it onto the skin. That is a very effective treatment to put on there, but so are a lot of these epidermal growth factors, a lot of these stem cells, where you don't have to, use the person's blood or the plasma from the person's blood once you spin it down. I like the results. I personally think they're just as effective. And I don't have to worry about doing the extraction of the blood or making sure that there's a phlebotomist there or a nurse practitioner or nurse there to do it. So I think it's very effective using the peptides. Why do I peel pre-needling? Well, it just takes it to the next level. So by using like a 30% lactic peel, it really helps break down the skin and make the skin a little bit more supple. So when I go in with the needle, I'm not really having to bear down, and I get the results much faster and much more effectively. So it's a simple step to do, and it's very effective. What to expect during a needling or a microneedling procedure. So there's 3 different types of needlings that we'll talk about. But during the procedure, you want to see redness. You want to see erythema, swollen, a little bit of swelling to the skin. You'll see tightness. You'll see a tautness to the skin. The skin will be sensitive. You will have pinprick bleeding in some of the areas. There are some topical numbing agents that you guys can use with a little bit of lidocaine, which really helps the client or patient feel a little more comfortable. I mean, it feels like a tattoo. I mean, it really does. And so the people that have not had tattoos, they don't understand how that feels. But you do get that kind of burning sensation. It's not pleasant. Some people can tolerate it just fine. Some people can't. After the treatment, you'll see redness up to 48 hours, a little bit of oozing of the serous fluid and the weeping. So you'll see like a pinkish fluid. It'll be blood and serous fluid kind of mixed. Dryness to the skin and tightness is pretty normal while they're healing. What you do want to avoid and what you want them to avoid is strenuous exercise. Anything they sweat, perspire, when they go out, garden, they go walking and in the heat, and then they sweat. That sweat is actually going to react to the skin. Sun exposure, definitely. Stimulating, exfoliating care products like retinols, glycolics, lactic, anything that rejuvenates the skin, you want to be very, very careful of. Just avoid this until the skin is back to normal. Some people say, well, when is that going to be? And it really just depends. It could be 48 hours. It could be, 4 days. So the person's skin is really going to be the deciding factor. The recovery phase of the needling. So collagen is really important for the menopausal skin. So that's all we want to do is stimulate the collagen. So we want to cause an inflammation in the skin. The wounding of the superficial layers actually helps activate those responsive cells that actually boost and give that skin or that mattress kind of a lift. The epidermal, the cells actually close the wound, the fibroblasts and the new collagen actually heal. So you'll get a remodeling of the growth factors, the fibroblasts, and they create the new tissue, and they organize all the new collagen to give that skin a softer, firmer, more plump look to it as it heals. So as you see, the needle goes down, and that little canal just kind of closes up. And as it closes up, it closes and pushes that collagen up to the surface, kind of giving that mattress a new foundation. How often can you microneedle? So this is another question. I like to do 3 to 5 sessions, 2 to 4 weeks apart. What is the 2 to 4 weeks? What client, goes 2 weeks? What goes 4 weeks? And it all depends on the depth of the wrinkle and the thickness of the skin. A thinner skin, you want to go 4 weeks out. Like a heavier skin that can tolerate it a little bit more, that has a lot more wrinkles to the skin, a discoloration, kind of that porous or that kind of orange peel look to their skin, 2 weeks apart. And then evaluate after that, and you can always push it out if the skin's too sensitive. Deep wrinkles, definitely 5 sessions, 2 to 4 weeks apart. Stretch marks are probably going to be your hardest ones to work on. They are anywhere from 3 to 6, even sometimes 8 sessions, and you want to go about 4 to 6 weeks apart. Much deeper. We'll talk about the depth of that, but the stretch marks are a more difficult procedure to go after. But stretch marks and retinol together really do very nicely. So it's a combination of doing both. Scars, acne scars, ice pick scars are the only ones that are real difficult to work with. But other than that, like superficial scars or acne scars are 3 to 6 sessions, about every 3 to 6 weeks apart. Again, sometimes the collagen's really broke down in those scars and you're going to get a lot of bleeding from that. That's good. That's what we want. But just be prepared for it and prepared for a little bit more downtime. These are the needles that we were talking about. So a 36 head of needles versus a 12 to 16. And what you see is more concentration in this 36 than this 12 to 16. Why would you want to go with a 36? You have a denser wrinkle. You have something that you really want to plump up and boost. That would be lip lines, it would be acne scars, and it would be stretch marks. This is where you want to really go after that. A 12 to 16, you're probably looking at a little bit more superficial, still great to use around the lip area, but you can fan this out over the whole face. And then a nano. A nano has absolutely no downtime, and I like to use a nano just to push product into the skin. I'm not trying to change it. I'm not trying to take away a wrinkle. I'm not trying to, I'm just trying to stimulate collagen a little bit and put product deeper into the skin. That's where I find nanos are very, very beneficial. And if I have someone that really is worried about doing a 36 or 12 gauge and doesn't want any downtime, I will go with a nano. So here you see the depth of what the skin, of what depth that, so if you pick a depth on your machine and you have like a 36 gauge needle and you pick a 0.25, you see you're staying in the stratum corneum. But when you go 0.5, you're down into the epidermis. This is where we want to be to start stimulating that skin and to start the collagen rejuvenating. We want to be here. What determines the being at 0.5 versus 2.5? Well, a couple things. Your insurance, your state, your regulations. Are you working with a medical director or not? Because once you start getting into the epidermis, we're not supposed to really be there. We're supposed to stay in that stratum corneum up here on the surface. So those are things to check out. The deeper you go, you're probably looking at the 2.5 when you're dealing with like a deeper wrinkle or even a stretch mark. So that's when you pick that depth to go into. Now, if you look over here, you see like your forehead, your eyebrow, your nose, your eye area, your cheekbone, your cheeks, your chin, your upper lip, and, scars, stretch marks, and surgical scars. So this is telling you when you have a thin skin, and you guys have seen this skin, this is a thick skin. You can see the orange peel to it. You can see the thickness to the skin. This is a thick skin. A thin skin is someone that has really kind of slick skin. Like you can feel like there's bone in their skin. There's not really a lot of fat cell underneath there. So when you're trying to gauge how deep to go, well, a thin skin, 0.25 to a 0.5 is as much as you want to go in that area, because other than that, you're going to be too deep and you're not going to be rejuvenating what you want to do. So this guide right here, you guys might want to take a picture of, is a good guide to gauge the depth of your needle when you're microneedling. Hope everyone understood that. Again, we'll just kind of go over it. So forehead, this is your needle depth that you really want to stay between a 0.25 and a 0.75. When you go around the eye area, the orbital area here, 0.25 to a 1.0. The nose, 0.25. You don't want to go over a 0.5. And then the cheeks, yeah, you can go between a 0.5 and a 2.0. And then down around the lip area, I've kind of stretched that a little bit. 0.25 to a 0.70. I've even gone like a 2.0, 2.5, 3.0. It just depends on how deep that lip line is. Not directly on the lip, but the line itself. The lipstick bleeds. The technique. So you'll see the technique. So cleanse, evaluate, light, peel, and then we start with the hyaluronic and the needling. So you just basically want to go up and down and across. So don't, not only do you want to go into the wrinkle itself, but you want to go across it as well. And a crisscross here on the number 11s, the same on the nose. Cheek, always remember to go upward, diagonal. So it's very similar to your microderm, passes. Now, exciting, we're going to get into the demonstration. So any questions, I know you guys are writing them and we'll answer them afterwards, but we are now going to go into the demonstration. So I'm going to get my model, I'm going to get some water here, and you guys will count down how long we have on the demonstration, right? Take this. It'd be really exciting to hear how many of you already do microneedling, and what you've seen really good results with. And all right, so our model today, our client, she has already gone through a perfect 10 peel, and so we are trying. So you'll see some peeling on her if you have some good HD screen there. So she is still peeling from that, but she is on a course that we've decided to be more aggressive with. So not only am I combining IPL with her, a perfect 10 peel, which is a Jesner peel that actually causes this layer peeling. We've got a ruby red peel and then a derma peel, which you apply in 6 to 8 layers, and then that sheds the skin. Why do we want to do that? She had a lot of sun damage. She hadn't been able to get her Botox recently, so she was getting some lines in her forehead, and she just really wanted to kind of pick up and tone. So the combination of this IPL, a Jesner peel, now we're going to needle her, and then in about a week we're going to come in and we're going to do some ultrasound on her skin to kind of rehydrate and reboost, and then just help with the overall health of her skin after we've kind of beat her up a little bit. But we notice right now that she's got the pigmentation is kind of evening out, so it kind of helps with all that. So I'm just going to go ahead and cleanse her skin. And I'm using a gel-based cleanser. It's got a little bit of enzyme in it. Sherry was talking about her husband liking this. It doesn't really suds much, so you won't see that because there's no sodium lauryl sulfate in it, but it really does clean the skin, and this has an enzyme to it that breaks down the skin and just gets it really clean. So dirts, oils, makeups, you don't need anything else on the skin like a makeup remover because it's doing it all. And a lot of times the skin's so clean after this you don't even need a toner. But we're going to go ahead and tone her skin afterwards just to get it very clean. Before you needle, you can also use a witch hazel. Our toners have some witch hazel in it, so we're going to go ahead and use those. You are still peeling.
That's probably the...
Oh, did you put moisturizer on?
No, it's the numbing.
Oh, the numbing, that's right. So Kim has already prior numbed, and she did the BLT. It's just a lidocaine combination. A lot of your distributors that you buy your supplies from, like sponges and gloves, you know, will have it. It's just a 3-packet that you mix up and then put onto the skin. I like to make sure it's on the skin about an hour. So Kim has put this on the skin about an hour. You can try it, you know, if they're coming in and you still want to get an hour treatment done, you can put it on for about 20 minutes. But I like to break the skin a little bit, so I like to needle a little bit, then put it on. I find it's much more effective that way. We can't really use a strong one, so, all right. So this has a little safety guard on it for the needles. Here's the tip with the needles on there. We're using a 11 on her skin because there's not a whole bunch that we're worried about with Kim's skin. We just want to give it some tightness to it and tone. Okay, so I've got the needle set. Just going to go over the skin with a little bit of toner. Again, it's got a little bit of witch hazel in it, which really helps disinfect, make sure that skin's super clean. And again, if it's not your rules, your regulations of your state, you know, do the nano, do the 0.25. I mean, just do them a little closer together. I mean, do a peel, do a little microderm, then do the needling. I mean, there's ways that you can kind of get around that a little bit and really have an effective treatment. So, good. We've got that going. I am not going to peel her skin this time just because she's already had that really deep peel. I don't want to sensitize her skin anymore. So I'm going to go right into the hyaluronic, but I would do the peel at this point. We just used Kim for a peel last week, which was perfect for what we're doing today, but I don't want to subject her to doing even more on peeling. All right. So, hyaluronic acid. This is going to be my glide. How are you feeling? By the way, Kim and I, we've been together since COVID, and we've had our vaccines, and we stay pretty masked up during the day. So we're not wearing masks right now, and in our state, we actually wear masks where we treat clients, but clients can actually take their mask off in the room. So it's been great. We haven't had any problems, you know, thankfully, and we're just grateful to be back to work. All right, so I usually start over here, and you'll see I'm just putting a little bit of pressure on the skin because you want the skin taut. Sometimes it helps because of the hyaluronic if I just have a gauze. And you're going to see I'm going to start right now. And with Kim, I'm just on about a 0.25 right now in depth. And I just want to see how her skin's going to do. You see I'm kind of tapping it. And you can see that redness to the skin. I don't know if the camera's going to pick up as much. But again, I want to go over it. Now you can do earlobes a little bit. Saggy earlobes break down, you know, the earlobes break down a little bit. I like to go ahead on the earlobes themselves and a little bit right behind it, which just kind of picks up this skin a little bit more. Now you guys are getting my tricks, which I'm sure you guys are already doing this. All right. As I'm moving it, I'm stamping it. Are you okay?
Mm-hmm.
You comfortable?
Oh yeah.
All right. So I'm going to pick up, go a little bit deeper. All right. I'm going to pick it up to about a 1.0.
Tina, did you have the rest and restore as your glide?
I did, yes.
That's what I thought. Okay.
I'm
And
sorry.
that's got the hyaluronic, and someone did ask about the molecular weight. While you're doing that, would you share a little bit about the rest and restore and the molecular weight of the HA?
Sure. So the it's a very light molecular weight on here. It's a 10% hyaluronic gel, and as you can see, it's actually going into the skin as we're penetrating it in. It does have some other active ingredients in it as well, which I'll run through that slide with you guys in just a bit. Let me get to this. I can do multiple things at once, but I'm watching around her eye area right now because we're right here. So with her eye area, I'm pulling it down because I want to be right on that bone area. You can treat right underneath the eye area, but you want to pull that skin down a little bit so that you have that structure of the bone there. Kim has really no wrinkles on the lip. Now, say she had like some deeper lines or lip lines or even some acne scars, you know, I will kind of flick it just a little bit. And I am doing a little bit of tearing when I do that. And what I'm trying to do with that is I'm just trying to nick these areas that might have had some scarring to them. You okay? Sorry. Chin's a little bit deeper. She's getting a little bit of pinprick bleeding up here underneath her eye area. I like that. I'm going to keep going until I get a little bit more and show you guys some pinprick bleeding. Now they will probably stay like this. The weeping will stay for about 60 minutes or so. That will then go away. The nose, I'm not going to go up there yet because I want to turn it down a little bit for the nose area. Now this is very important. She's got permanent makeup to her eyebrows. You want to avoid the areas where they do have the permanent makeup because you do not want to cause this pigmentation to go anywhere, to bleed, or to actually cause it to fade. So I'm first starting in the forehead, kind of up and down. And then you'll see me go through the actual wrinkle itself. Number 11's here. Now you can get in as long as you stay on the bone. Now say she didn't have permanent makeup, you could go through the eye area, the eyebrow area itself, and you can go on the upper lid here as long as you stay on this bone. So you want to pull that up and go around here. All right. see. It's getting quiet now. All right, so one more pass in this area. We're getting the redness, the erythema that we want. That's all good. You don't have to bleed to get this, and to get the result. So I would not go near the lip or like on the lip itself when I do my needling. I know some people that do, but I avoid the actual lip itself, especially if they're prone to cold sores. You definitely want to make sure that they're taking something if they are prone to cold sores. Kim is concerned really about her lower eyelid, so I'm going to make sure we really hit that area. All right. Just getting some bleeding up here, which is normal because it is a lot thinner up here and I'm still working at a higher percent. So at that 1.0, there's the pinprick bleeding she's getting. She's getting it on her lip here.
I'm doing omega fats as well.
Oh, okay. So she does omega fat vitamins, so she is going to get a little bit more bleeding. I think she does some wine at night too. That will actually cause them to bleed a little bit more. So alcohol the night before, same thing. Aspirin, you'll get a little bit more bleeding. I mean, it's not something they need to stop. They're usually on it for a reason from their doctors. I know we have these needling pens are taking a little bit longer to come in, but I know Sherry will be excited because we have these coming in and it'll hit the website soon. I've really enjoyed working with these. Now I will disinfect this whole thing when I'm done. You can put a bag and a sleeve over this. I know they have the permanent makeup sleeves. We even use like a sandwich bag. So, all right, almost done with Kim. Very quick procedure. And it's really just knowing about the skin and all the different techniques that you can do on the skin to rejuvenate the skin and build that mattress back up to make that foundation, that collagen, that elastin, once that's boosted. And I always feel like we're giving them a little bit of their own filler right now. So I have them wait to assess if they want filler about a month after, 2 months after, just to make sure that they don't get overfilled. I'm going to go right above here because I did the other one. Staying on that bone. She's reacting very well. And she's staying still, which is great. You see the swelling, a little bit of, you can go up underneath the chin to tighten that area as well. You can get the jawline. And you can do the neck. So just lightly on the neck. This helps with the fine lines. We're really trying to just perfect what we do on the neck area and the treatments that we do on the neck area. All right. She's not liking me now because she's not numb here.
It's not that bad.
I just want to treat these couple. And we got to get to the nose. Okay, so she's completely dry. All that's kind of gone into her skin. This is the worst part right here, the little bow. How much time do we have still? 5 minutes? Okay. You can't see it on this side, but if they have a pigmented area, like any type of sun damage or freckling, you know, really work that area because you'll see a huge difference when they heal afterwards. Oh, I can't forget this other ear either. Tattoos, again, remember, avoid. If you're peeling and they've got any type of piercings, make sure that you know, block that area. Don't get any peel in that pierced area. Nose piercings, eyebrow. That's a whole nother class, but use your peel rules along with this. Okay, I'm going to turn it down a little bit to get the nose. And yes, you can get the tip. Everyone forgets about the tip. It's really bony, so it's not going to be as pleasant, but we're almost done. I think the corners of the eyes are also important. That just, if you can tighten this area up here and here, you give a nice like lift to the eye area. So and you're doing good. One more pass just lightly on the forehead. And basically I want to see these fine lines pop out. So I'm going to keep irritating them until I don't see them anymore, until they're kind of flush with the skin. And that's just swelling in there, and that's what we want. No picking, pulling, scraping, digging at the skin after this. It is going to feel tight. It is going to feel wounded. It's going to feel like a sunburn. So you can treat it with a little post-peel balm while it's healing. You want to be careful because it's wide open. So even like, say you're at a restaurant or you go to the bathroom and you touch anything, you're going to put that right into your skin. So I always advise them to go right home after this. And you don't want to put anything on your skin. You don't want to touch it. You don't want to play with it. And certainly don't want to garden. And I'm only saying that because right now everybody's into gardening and going outside, walking, and getting some exercise. Well, if you perspire, the sweat is also going to irritate this, and you could end up with some dermatitis or a little bit of a reaction. So, all right, so she is done. Disposing of this, putting the cap back on it is important. A sharps container. Just go ahead and put that in there because there is going to be some blood on there, some fluid. All right. You can see the skin where she's a little irritated. The hyaluronic's gone right into the skin. Now I'm going to put a little bit of the epidermal growth factor on. You okay? All right. You can put a little bit more of the hyaluronic gel if they're super dry. I like to just put a little bit of the epidermal growth factor on to calm. Now this peptide is going right into the skin. Get the earlobes. It looks great. I've got everything I want. I've got the swelling. I've got the redness. I don't have a whole lot of bleeding. I do have pinprick bleeding. I like that we did up here, which then gives that tightness to the eyelid and gives a little rejuvenation of that eyelid. And then of course behind the ears, just to kind of give this a little lift. And doing underneath here, you give it a nice contour. Can they use ice packs? I want to be careful that they don't freeze the skin. I want to be careful they don't put something on the skin that's going to cause it to react. So I always say like something light like peas or frozen carrots they can put onto the skin. But ice, I don't really want ice sitting on the skin afterwards. I just find that it will irritate the skin. Okay, moisturizer, sunblock, no sunblock, no moisturizer. I know that's weird to hear, me say no sunblock, but no sunblock. It shouldn't be in the sun, and I don't want that sunblock going into those pores because those little tunnels that we just did are wide open. So anything we put on the skin is going into the skin. It's a little more hyaluronic, and I'm going to send her home. No retinols, no alpha hydroxys, nothing aggressive, just soothing. I'm going to send her home with a post-peel balm just to use while she's healing. No sun, so no sunscreen for about 2 days while everything is healing up. No retinols, no glycolics for about 4 days, and until the skin kind of reheals. But Kim is exactly what we're supposed to have. So you can see all that redness. See our earlobe. That's exactly what we want to see. So what do you think, Sherry?
Awesome. I'm popping back on. Hold on. Awesome stuff.
Are we good on time?
We're great on time, actually, because we still have time for questions. I know there's a lot. So
good. All right, I'm gonna let our model go. Okay.
Okay.
Unless you want to, do you want to show up? Come right up front so they can see. Well,
yeah, that would
get real close to the. I wanted you to get. See, that's where you're getting all the erythema. That's perfectly normal. That's exactly what we want. Okay.
And that is, I love microneedling. So
I do, and you know, she only had really the forehead that we were going to work with, but her eye area she wanted to plump as well. You can just really tailor it. You don't have to do the whole face. You can just do areas. Some people want to just come in and have different treatments. That's why I'll do a combination of micro, ultrasound, peel, and a little needling. So it's just really, it's up to the, your client, the patient, or what you want to get for the result. And I've really enjoyed combining like an IPL and this microneedling and an ultrasound and a deep peel to get the results that I need to get someone back to where they're supposed to be.
No, and actually customizing it is definitely the key to keeping them happy, for sure. I'm really glad we got the slides put up because I think that made a big difference and everybody loved it.
I wish we knew that before. Oh no.
I'm so sorry about that, but good. We got in early enough, I think, and we were able to show some of those. We do have a good amount of questions, so I want to go over those. Now I want to give myself a microneedling treatment. That's the problem. When I see these things, I'm like, okay, now I want to do that now. Okay, so let's go through a couple questions.
Sure.
Here. Let's see. All right, here's the questions on. You would talk early in the beginning about the diabetes being a contraindication. The question is, with microneedling, is it a contraindication if it's controlled, or is it if
no, if it's controlled, it's fine. It's just if it's a bleeding disorder or if they have trouble healing, that's really the problem. But there's a lot of people with controlled diabetes that get pedicures and peels and microderm. Yes, controlled is the key. Controlled.
What are your thoughts on the nano pens that use the silicone chips versus needles? I think they're talking about like the nano infusion, the ones that are made out of pure monocrystalline silicone, not the metal ones, versus the needles. In Indiana, we have to be under a doctor to do microneedling.
Yes, of course. Yeah, a lot of states we have to be underneath a doctor, but nano needling you can still do. You don't have to be underneath a doctor, or if you stay in that surface of the skin, you can even get away with like a 0.25. It just really depends, even on your insurance, but I know that's a touchy subject because even though your insurance says yes, you can do it, if the state says no way, no how, no pen, then it's hard. But I would just do some nanoing and I would get creative with it. I would do a peel or a deeper peel if you can do something like a Jessner, and then do a little bit of microderm and then do your pen. You're getting in there. So it's all about how to use what you have and resources that you have to get that result. And we've had to work long and hard to figure all that out. But yes, and silicone versus the needling, I have no preference. I think as long as you're wounding the skin and you're getting that skin, that wound, it's all good.
And that is, I will tell you, what we have found with the nano is that most states allow it, but here's where the problem falls in. If you have a pen that allows you nano and microneedling, because a lot of pens have combos.
Yeah.
Some state boards will not allow that because there's a depth knob on it. So if you get a nano pen that does not have an ability to change depth, meaning it's just a nano pen,
yeah,
state boards, they're fine with that. But if the pen is,
Yeah.
you may not be using the actual needle, so you put a tip on it that's nano, but
Yeah.
they see that it's an adjustable pen.
Yeah.
That's where we've seen trouble in terms
Yeah.
of the states that come in and visit. So when you're thinking about a nano pen, if your state is one of those states and the board's coming to visit you and all that good stuff, and you're worried about that, just make sure the pen you get does not have an adjustable depth. That'll help. Could you do a nano a couple days before a special event? Yes, you
Yes.
can. And don't you agree? Yes.
Yeah.
Let's see. Do you recommend? Okay, here we go.
But would you do one if you've never done one before? I would try one first just to make sure their skin doesn't react or they're not hypersensitive, or if you know the skin. I wouldn't do someone just off the street.
Yes, that's true. And also being careful what you're nanoing in.
Right,
Because
exactly. Yeah.
that's really
Well,
important.
you know, I mean, I've had some estheticians call me that are nanoing in salicylic or that are nanoing in Jesner peel, and that's kind of how they're getting around going deeper into the skin, and not advised.
Yeah. Let's see. Do you have recommendations for body microneedling for stretch marks?
Yes. So back we talked about it. I would go deeper in your needling. So a 2.5 to a 3.0 if you can adjust your pen. I would do a 36 needles versus a 12 or anything less than that. And I would combine it with retinol and alpha hydroxy. And the reason why is because you really want to get into that area. And, you know, I would say not that night, but the next night, start your retinol treatments on that area. So where we avoided on the skin with a stretch mark, I would go right to it the next day and alternate it with your alpha hydroxy cream and your retinol. So like we have a Revitalift that works really well, and then we have a Rejuvenation 10 that works really well. You can use those both on the stretch marks. You'll get a real great result. Or a tube of Retin-A. I mean, if they have it sitting at home, it's great.
You know, and it's interesting.
We froze. Did we lose you, Sherry?
The straight tretinoin, you can get very. Let me see. Let me flip over here.
There you are.
I'm unstable. It says my internet's unstable. I'm unstable. Okay. Do you ever microneedle the neck? You were showing that earlier, so yes.
Yep. Same motion, up and down, side to side. Yes. A little bit lighter. Keep it more superficial, like a 0.5 at the most.
Okay, here's another one. In microneedling treatments, is it safe to do a layer at one depth and then change the depth to do a second layer?
Oh yes. You want to go until you see that kind of inflammation in the skin, sometimes pinprick bleeding. Yep, you can go over there multiple times.
Yeah, and I think it's important to know when you're microneedling, it doesn't always have to be a bloody mess.
No.
But you need to see that response from the skin.
Right.
And it almost it's kind of like a flushing effect. Exactly. And you want to be able to, the skin needs to be reacting to that.
Yeah. Warmth.
Can you do microneedling 2 weeks after Botox?
You can do it 2 weeks after Botox because you're 14 days out. So I would just do the filler the opposite way. I would do your needling and then have them go do filler. But Botox, you're good at 14 days.
Perfect. So if no on permanent makeup, would you include tattoo areas also for microneedling? No on purple. So if no on purple, you said something about no on permanent makeup. What did you say about no on permanent makeup?
So you don't want to directly go over it with your needle.
Okay,
gotcha. You don't want to.
Can you go over tattoos?
No,
okay, yeah.
No, you don't want to go over the tattoos either. You just don't want to. You don't want to move any of that ink. You don't want to cause a bleed or anything like that. And you just don't want to wear down the pigment. So if it scabs, it bleeds, and the pigment comes out. So you want to avoid that area. You could actually remove some of somebody's permanent makeup on their eyebrow.
And they won't like that.
They won't. We used to use a microderm when somebody just didn't like their eyebrows, or so very similar to needling. Microderm, get in there and just kind of wound it and cause some scabbing, and then it all falls off. So yeah, no, stay away.
When stamping instead of dragging, does the speed of the pen matter, slower or faster?
No, it doesn't really matter because I'm going with I'm watching the speed and I'm watching the skin, so it doesn't matter the speed. It just matters the flow of how you're going. You might just have to go a little bit slower if your pen's a little bit slower.
Do you adjust the speed of your pen when you're doing it, or do you just stick with the setting that it's like one setting during the whole treatment?
Good question. I've not had a pen that I could actually adjust the speed. I could adjust the depth, but not the speed. And I think the speed goes with the depth. So the deeper, the faster, the more superficial, the slower. So I think it's calibrated in that sense that you like the one we're getting in is actually calibrated the depth and the speed. So you really can't control that.
Gotcha. You mentioned, would it be the same for, okay, you mentioned that you only stamp with needles. Would it also be the same for nano? So do you stamp with nano or do you glide?
No, you stamp.
Let's see. So legally in Texas, 0.5 is the longest needle and estheticians can use, question mark.
Correct.
Should I get that? I've always done my needling in circular motions. Does the tapping method provide better results?
Yes.
Okay. And I will tell you, you know, with watching people microneedle over the years, everybody has different techniques.
They do.
Everybody does different things. And I will tell you that, you know, when I sold microneedling, they had a method. And when I would sell devices, I would have to go in, I would have to train on their method. It was a very specific method.
Sure.
Then I switched companies and went to a different microneedling company. Their method was totally different. And I had to switch my gears and teach based on what they wanted it. So I find that when I microneedle, I do what Tina does. I go for the end result. So sometimes I'm stamping. Sometimes I may find in an area that I do a little bit of gliding. It's almost like you're intuitively looking at the skin and you're taking this device and you're waiting for a response. Mm-hmm. And sometimes you get that response one way and sometimes you can glide. So I don't necessarily think it's black and white.
Right.
I think there's a lot of gray area in here with technique. So I just want to, in working for multiple companies, knowing that they teach them different ways and they're both very successful, they get very successful results.
Yeah, and like I said, if I'm faced with a lot of wrinkles around the mouth, I'll wound it. I mean, it doesn't, all the time it's not stamping. I got to kind of tear it a little bit. And I hate to say that, but you know, you want that, like cheeks, not so much, especially on that model we just had, but like lips, you want it to get in there and do its job.
You get the results. Do you get good results when you stay at 0.5? Because in my state, that's as deep as I can go.
Yes, you get fabulous results. And like I said, the way you play with that is you increase maybe every 2 weeks versus 4 weeks or 6 weeks, and you use a peel, and you might do some other prep work prior to it. That's how you get your results. I've always, like, we do a lot of 0.05. Or 0.5, and that's mainly all we normally use. You know, we have several different guns, and that's the result we get. You know, you can even layer it with a thin coating of retinol. I didn't say that, but
you said that. I didn't hear that. I didn't hear it. Let's see. How would you retail the CIT with peel? So when you're marketing this and you're telling your clients, hey, like I'm going to put together this package, what's the spin you're putting on the combination of peels with microneedling? Are you telling them, here's what I want to do, peel you first, and then the other? So how do you pitch that?
So we're really blessed. At the beginning of the year, we kind of think like, okay, how are we going to go about changing people's skin this year? And so we sat down in a marketing meeting and we're like, you know, we need to hit browns, we need to hit reds, we need to hit fine lines, we need to hit wrinkles, we need to pigmentation. And so we dissected everything we had there, and clients love when you package things. They like a plan, and I know people are like, well, I just, you know, $800 is a lot of money to them. I'm like, spread out through a plan, it's not a lot of money because they're going to spend that anyway. So I just go through it. Okay, what's your major concerns? What do you want to change on your skin? Okay, pigmentation, wrinkles, laxity. this is what we're going to do. This package we're going to start with the IPL. We're going to get rid of those browns and reds. Then we're going to go into, taking off some of that surface cell. And then after the surface cell is off, because now your skin is finer, smoother, softer, we're going to work with the wrinkles. So we're going to go into the needling. And then after the needling, we're going to hydrate. So then we're going to put everything back in with an ultrasound treatment. It just all worked together really well this year. And it was one of our top selling packages for the year.
That's awesome. And I think, laying it out like you did, and then also saying, okay, client A, I'm hearing you. I hear what you want to do. I've put this, I've customized it. They feel that you've actually customized. You've not said, hey, just do a peel today, and in a couple months we'll do this.
Right.
They don't feel like you're just putting them on the list. You say, we're going to do this today, and in 1 month we're going to do this, and then 2 weeks after that we're going to do this. Here's the whole price. Maybe you spread out payments or whatever you need to do. But they leave there going, I have a plan. I have a plan.
Mm-hmm.
And that's so important. If you go to a gym and the guy goes, well, use that machine, and I'll tell you about other ones later. They don't have a plan.
Right.
You want to know what you need to do. So I think it's a really good idea. Let's see. Yes, it's 4:30. One last question then. Is there any concern for microneedling on melanated skin? So how do you treat skin of darker colors with microneedling?
I would stick with nanos and stick with something very light like the 0.25. I would never tear. I would just tap and go very lightly, and they could still do a treatment like that. But usually darker skins, we don't see a lot of the problems that we're seeing with laxity and wrinkles and fine lines. Usually darker skin, more melanocytes, more melanin to the skin is usually a thicker skin and a more youthful looking skin. So it doesn't necessarily need a needling versus, but I mean, I've seen where we have taken the pigment right out of someone's skin with a microderm machine or a really deep needle. So you really have to be careful. I would stay superficial and light. And maybe work with some peels on that client versus needling. And then maybe if you're just working in an area like a lip line or something like that, stay there. Don't go all over the face.
Good point.